Welcome back to CBS This Morning. How about some news on getting back to work as more states work to reopen? Knowing who has the coronavirus is going to be key. And one way to do that, it was something called contact tracing. That's about tracking down anyone who may have come into contact with a person who has tested positive. New York City, for example, says it plans to hire 1,000 people to help with that effort by the end of the month. Nationally, experts say it will take an army of people asking all the right questions. I traveled to Connecticut to find out how contact tracing works.
Hello, my name is Melissa. I'm calling on behalf of the New Haven Health Department.
Every day,
Your COVID-19 test result was positive.
people like Melissa Thomas are chasing some of America's newest cases of the coronavirus.
Do you remember when you first started experiencing feeling ill?
Their mission is to break the chain of infection by developing a list of everyone who may have been significantly exposed to a patient, then urging those close contacts to monitor symptoms and self-quarantine.
I'm really looking for any time from that Wednesday until now if you've had prolonged contact with anyone outside of your house.
And while this call was only a demonstration,
I had a colleague from work come over.
Thomas says she can usually reach about 60% of the patients she tries, getting all the information she needs in less than 30 minutes.
I think the hardest part is getting the people to answer the phone in the first place. For those that we actually reach out and talk to, whether they answer the phone or call us back, they're very willing to help.
Contact tracing is proven to help control diseases like Ebola and SARS. And as of now, it also seems to be working for the New Haven Department of Public Health in Connecticut, where Thomas is a volunteer.
So at your very best rate, as quickly as you can go, you're going through 2 calls per hour with people picking up?
We're doing between 2 to 3 an hour.
2 to 3 an hour. Is that quick enough to make the case count go down on the computer?
So in New Haven, we've averaged about 100 new cases a day, and with our team, we're able to handle that.
But there's no federal requirement for contact tracing, leaving states and cities to create plans of their own.
I think it's important for us to come up with a strategy that says we're not just going to try and mitigate the disaster, we're actually going to try and contain the growth of the virus.
This is an opportunity to go out, find the embers, and stomp them out before they become a wildfire.
Exactly right.
Massachusetts Governor Charlie Baker announced the first statewide contact tracing program last month. It's grown into a 1,000-person team, reaching hundreds of patients a day.
People want to talk about what it means to have this virus. They're looking for help with respect to how they isolate. And they're willing to give us their close contacts, which, by the way, so far have not been big numbers.
But those numbers are likely to spike as people return to work. And to stay ahead of the pandemic, America will need an additional 100,000 contact tracers, according to Johns Hopkins University. By one count, states have hired or announced plans to hire about 66,000 so far.
Does the lack of a federal standard put your state at risk and surrounding states at risk?
I certainly think if the feds were to participate, if the feds were to establish, as you say, national standards or some rules around compatibility with respect to one state to another, because you're right, there is a lot of back and forth between states, and people move. I mean, they don't just work, they move. I think that could be very helpful.
As more Americans test positive for the virus, researchers say confidentiality is key for contact tracing. That means shielding the identity of every COVID-positive patient, even from the people they may have infected.
Contact tracing is critical. Virtually nobody disagrees with that. But out there in the public, there is a concern that the more that the government, even if it's the health department, is prying into people's lives and movements, the less privacy we'll have as Americans. How do you balance the public health mission with the privacy concerns of citizens?
I would say we take confidentiality very seriously. That's a big component of what we do as far as not sharing information of who is a positive test result. That is extremely important, but also by notifying people that they may have been exposed, it greatly reduces the spread of the disease. So the more information people can provide, the better and the more effective that this technique will be.
And speaking of the future, technology is also expected to play a really big role in this effort. Google and Apple later this month are expected to debut a tool, an app, allowing people to receive an automatic alert if their phone has been near another phone of a person who is COVID positive. But for many people, that brings up big privacy concerns, Gail. And in fact, a recent poll found that more than half of Americans, even if such an app existed, would not be willing to use it, at least so far. We're, of course, going to be covering that as the technology begins to roll out. But contact tracing, it's a term we've heard a little bit. We're going to hear it a whole lot through May and into the summer. I'm sure of that, Gail.
Wow, wow, Tony, I can't wait for that tool from Google and Apple. I will certainly be the first one. I always think people have nothing to hide nothing. I know privacy is very important here. I also think that knowledge and information are power. And the more knowledge and information we have, the better off we are. Seems like we just have to get people to answer the phone. It's tough.
Yeah, that's true, Gail. That's definitely true. I mean, another one of the questions is, if you've come into contact with somebody and you have to isolate at home, how do you make money? How do you make a living? One of the interesting proposals from President Trump's former FDA commissioner, Scott Gottlieb, he's leading a group that wants $30 billion from Congress to help pay people, if they're contact traced, to stay home and be safe. $30 billion, a lot of money, could go a long way.